soldiers can see clearly at Winn Army Community Hospital, and a new clinic brings health care to Virginia military families. This is the Regional Health Report. Welcome to the Regional Health Report for June. I'm Ann Krebs. The Warrior Refractive Eye Surgery Program reduces the need for eyeglasses or contact lenses. We take a detailed look at how Eisenhower Army Medical Center and Winn Army Community Hospital join forces to support vision readiness.
Everything that we do in the Army to prepare soldiers is focused around readiness. Vision readiness is among the most important aspects of medical readiness. To be effective in combat, everyone has to have the ability to shoot, to move, and to communicate. The ability to operate without requiring corrective lenses
Got one casualty in here.
in any situation provides a higher level of readiness to adapt to any situation rapidly.
We have multiple different types of battle spaces that we engage in around the world. Not all of them are predictable. Eyewear is unpredictable. Refractive surgery gives you the ability to reduce your dependency on eyewear. The fact that we can actually reduce your refractive error to make you a more lethal soldier in the battlefield is a huge combat multiplier as far as I'm concerned. Photorefractive keratectomy is my go-to procedure for most individuals. The actual procedure itself takes about 10 minutes to do both eyes, depending on refractive error. And we treat anybody with a refractive error from about a +3 up to about a -8, depending on their corneal architecture.
Having the ability to do this and to increase the readiness ability of the soldiers makes Winn vital in the readiness platform.
Having this training opportunity and being a part of the surgery has helped my readiness by building me as a surgical tech, building me as an eye technician, building me as a soldier, expanding my skills and knowledge. It's an amazing opportunity to come to Winn from Fort Gordon and to collaborate with another team and experience a different kind of surgery and give that opportunity to the other soldiers.
If I have an ability to bring somebody to my organization and help train them, I'm going to do it. And if I have the ability to go to somebody else's organization and train there, I'm going to do that as well. So I think sharing our resources is going to be a huge way forward under DHA. I think it's really going to help us out. The Tri-Services Army, Navy, Air Force has been doing this for well over a decade with outstanding results. So I think it's one of those things where we offer this to the population as a service to enhance their battlefield lethality. And across the board, I think it's a huge win.
Community-based medical homes are Army-run primary care clinics located off-post in communities where military families live. McDonald hosted a grand opening for its new medical home in Williamsburg, Virginia.
The Williamsburg community-based medical home is a leading-edge clinic. This 8,000 square foot facility and its 52 employees provide first-class health care to 7,000 plus multi-service beneficiaries in the Tidewater area.
We cannot lose the sight of the impact of family care on the readiness of our soldiers. It is critical and essential for not only the success of the Department of Defense, but our Army.
The medical home reestablishes the idea of coordinated, whole-person and long-term care. The clinical team provides continuity.
I think the most amazing thing here is the staff. I mean, the building, of course, is absolutely beautiful, but the people are really what bring the warmth to any establishment, and I really feel like the staff bring that.
We have some great doctors. We handpicked nurses from McDonald to come out here because I knew they were the best of the best. So I just hope they have a great experience and they share it with everybody and more people come.
Enrollees will have access to routine medical care, labs, physical therapy, and pharmacy.
Now, there was a time when doctors made house calls and physicians would ring the doorbell and bring health care directly to the patient. Well, the days of the house call they're over, but I think this is the modern model of the same thing. The idea is enhanced. We're bringing all the benefits of this team-based approach of a patient-centered medical home and combining it with greater proximity to the patient. The result is better care with improved access and convenience.
5, 4, 3, 2, 1.
For the Regional Health Report, I'm Craig Coleman.
In other news around the region, Brenda Gutierrez from WOMAC brings us the story about a program designed to help National Guard and Reserve soldiers stay medically ready.
Operation Reserve Care was founded on having medical readiness for soldiers, reserve soldiers, to get their dental medical status at a ready and a go, so that they're medically ready before deploying, and it's all kept within 1 year. We're here first weekends of each month. On average, we treat about a total of 200, between 200, 300 soldiers a week. It's a collective census of active duty reserve National Guard. The end state is to make sure that we are decreasing the time that soldiers are having to miss from their civilian jobs and increase their medical readiness so that they're medically ready to deploy at any time.
It really is like a one-stop shop. You come here and get everything done and get to leave and not have any problems or worry about making additional appointments for other things or going other places to get other things done.
So once they come through Operation Reserve Care, it updates in the live time within the MedPro system. So for units who are red or below the required standard, you know, it takes just days for them to go green. So they'll send their soldiers over, they'll send larger packs counts, sometimes they'll send the entire unit. They can come through, be seen, and their medical readiness numbers are now in green.
Troop Command South Captain Justine Stremick was named the 2018 Army Female Athlete of the Year by the Association of the U.S. Army. A member of both the All-Army and All-Armed Forces volleyball teams, Stremick says the award is an honor and it gives her an opportunity to represent both the Army and the U.S. military in a unique way. In October, she will compete in the Military World Games in China. And that's the Regional Health Report. Join us next month for another show highlighting health and readiness across the region. In the meantime, don't forget to check us out on your favorite social media sites, YouTube and on iTunes. Thanks for joining us. Center